So, hello everyone. Just a minute, let me check if it's, yeah. Hello everyone, good afternoon.
Brother, speak louder, please.
So today my presentation is about Valsartan. It's angiotensin receptor blocker, and it's mainly used. Can you all see my PPT?
Yeah, we can.
Yeah. Carry on.
Okay. So these are the brand names: Divan, Starval, Valent, and Valzar. These are the most commonly used brands of Valsartan. So it's mainly indicated for hypertension, especially for pediatric hypertension, like for children who are from 6 to 16 years. And it's also for congestive heart failure and post-myocardial infarction and left ventricle dysfunction. So the dosage, actually, like the main criteria for treatment of with Valsartan is like we'll start with low dose and then we'll increase slightly. So for congestive heart failure, the initial dose will be like 40 mg orally twice a day, and then maintenance dose will be around 80 to 160 mg twice a day. And later, like the dose should be increased up to the highest dose that can be tolerated by the patient. For hypertension, the initial dose will be like from 80 to 160 mg once a day, and maintenance dose will be like 80 to 320 mg once a day. And for pediatric hypertension, like 1.3 mg per kg once a day. So the maximum dose should be like up to 40 mg, and maintenance dose is like 2.7 mg per kg. It should be up to 160 mg once a day, and should be titrated according to the patient response. So coming to the mechanism of action, it selectively binds to angiotensin receptor 1. As I told you, it's like a blocker, so it will antagonize the action of angiotensin. So prevents the angiotensin 2 from binding and exerting its hypertensive effects. So mostly like when angiotensin 2 binds to the receptor, to angiotensin 1 receptor, what happens is like it will exert some kind of hypertensive effects, like it will constrict the vessels, and so pressure will increase, and it will stimulate the synthesis of aldosterone and ADH, antidiuretic hormone, and it will stimulate the cardiac output and renal reabsorption of sodium, among others. So overall, Valsartan's physiologic effects lead to reduced blood pressure, lower aldosterone levels, reduced cardiac activity, and increased exertion of sodium. Should I briefly explain the mechanism, or you are okay with this? You got the idea?
Yeah, it's okay. Yeah, it's okay.
All right, so that we can move to the next point.
This is okay.
Then we'll move to the pharmacokinetic properties of Valsartan.
Okay.
Excuse me a minute, my laptop is hanging, so I'm trying to move the slide. So far, do you have any doubts?
No.
What's the difference between losartan and valsartan?
Losartan.
Combination. Valsartan.
Huh?
Valsartan is a combination drug.
Like with what is common? Like sacubitril you're telling.
Sacubitril and valsartan.
There's some other difference also. I think I had read somewhere, but I forgot.
Hmm. And sacubitril separate mechanism is there. He didn't say about that.
Oh yeah.
Hmm.
I think the difference between valsartan and I'm not sure actually. I didn't read about that, but whatever you are talking about, like China is combination. So I'm talking about monotherapy here, and I think the difference will be in the frequency, not frequency, potency. So coming to the pharmacokinetic properties, uh, it's orally absorbed with onset of action of 2 hours, and it has a peak of 2 to 4 hours. Okay, but the food decreases its absorption like up to 40% of dose. It's highly protein bound, and it's like up to 95% bound to plasma proteins, especially mainly albumin, and it's metabolized by liver, and it's not it's not by transformed to a high degree. So it's just a little bit. It will undergo metabolism of like 20% of single dose recovered as a metabolite, and it's mainly excreted by feces, like mainly by feces
Is
as
it
a
given after food?
huh? Come again?
Food or after food? Is it given
It,
after food?
yeah, it can be given before food or after food, but it should not be given along with food. Like you should just maintain a gap. Like food will decrease.
It's after food. Yeah, food will decrease.
Uh,
I can't hear your voice.
sorry.
I can't hear your voice.
Yeah, suddenly I felt like voice has stopped, so I thought some problem with the network. Okay, so I said
Okay.
like it's mostly given before food. Okay, like it should
Before
be
food.
yeah 1 hour before food.
Okay. Hmm.
It's mainly excreted by feces, as I told you, as an unchanged drug, and urine about 13% of dose. Side effects: bloody urine, cold sweats, confusion, decrease the frequency amount of urine, and then difficult breathing, dizziness, faintness. Uh, Mostly, it affects the central nervous system, and it has slight cardiovascular events, like it affects cardiovascular system. But the interesting point is it does not, like the hypotension, like the excessive hypotension is rarely seen with valsartan. So it will just maintain like blood pressure, even if it goes below the normal level, it won't go like so very down. Okay, then weight gain, vomiting, uh, unusual tiredness, weakness, and nervousness, nausea. Interactions. So it interacts with acetaminophen, naproxen, amlodipine, aspirin, atenolol, atorvastatin, diphenhydramine, biostolic, nebivolol, uh, tadalafil, loratadine, rosuvastatin, duloxetine. It has one interaction with one of these and the angiotensin receptor blockers, but I did not read about it like mechanism exactly. So I will just check and I will inform you about that. And yeah, it interacts with grapefruit also. All right. And then clinical pharmacist perspective, we should avoid co-administration with food, avoid taking with citrus juice, and it's highly contraindicated in pregnant women. Like it will affect the development of the fetus. All right. So, any doubts?
Why it is contraindicated in pregnant women?
As I told you, like some studies say, like in animal studies, it did not show any teratogenic effects on the mice, but it has shown that it will affect the first of all it may cause like early birth and the development of the fetus, the development, especially if it's like in the early stages of pregnancy.
Okay.
Okay, and in the like in the trimester, like third trimester, what happens is it may cause like uh, earlier delivery birth. So once the pregnancy is confirmed for a girl, like should immediately stop the valsartan and like refer the doctor to change to another.
What formulation it is available? Is it available as tablet or?
Yes, it's mostly given as a tablet or a capsule.
Okay, no IV routes.
Yeah, IV routes, but it's not mostly given. It's supplied as
Is it
generic only.
available?
Yeah, generic.
Okay.
Okay. Then cost.
Cost, I'm not sure about it.
Okay.
I will also check for you the like how the Vimada. It's like a newly came drug, which is a combination of 3 drugs. So I will make a short note on that, and I will inform you shortly about it.
Is there any renal dose adjustment for this?
Yeah, there are no those adjustments, but if the creatine clearance is less than 30, okay, it's not recommended for children, and for adults we should just use with caution.
Okay.
As you mentioned in adverse effects, there is weight gain.
Yes.
So, can you explain, like, is there any specific mechanism through which it causes weight gain?
So far, I'm not sure about the mechanism, but one thing is that it will prevent the reabsorption of sodium and water. So like mostly the weight is the body weight is mostly composed of water.
It prevents reabsorption, or
Yes.
no? You know what you said is it prevents reabsorption of sodium and water.
Huh.
It does not prevent. It causes antidiuresis, no?
Yeah, it causes
Decrease
antidiuresis.
urinary frequency means like decrease.
Sorry.
Okay.
So reabsorption will be more.
Yes, reabsorption will be more. Exactly.
Mm,
Any more doubts?
No good.
Yeah.
In pregnancy, is there any effect on the amniotic fluid?
Come again? I didn't get you.
See, it is contraindicated in pregnant women.
Huh.
I'm not sure is this reason true or not, but I have read somewhere like it may affect the amniotic fluid. Is that true?
I'm not sure about that. I will just check and I will let you know.
Okay.
You can stop recording, then discuss questions.
Yeah, sure.